Now that we're on daylight saving time and the weather is warming up, it might be time to take a look at your skincare routine. And we have an expert here sharing some essential tips on how to protect your skin. Dr. Dennis Rousseau, surgical oncologist with Baptist Medical Network, is here to answer some of those questions. Doctor, let's talk about common skin issues that people face and they should be aware of, particularly when it comes to skin cancer.
I always like to look at it as three factors. The first is know your skin, the second is know your family, and the third is know your exposure. Okay. Skin types. The fairer skinned you are, the more likely you are to suffer sun damage and skin cancer. And so if you're blonde hair, blue-eyed, or the classic I don't tan, I burn, very fair skin, very high risk, whereas darker pigmented skins have much less risk. Secondly, if your family has a history of skin cancers, you inherited some of that, and you should be aware of that so you can be followed more carefully. And lastly, exposure. How much sun have you had? Most of us get most of our sun exposure when we're younger, but thinking back on how much sun we've had, how well we've protected ourselves from it, lets us have an idea of what our real risk will be.
So how can we protect our skin from those harmful UV rays during the longer days and, of course, those summer months?
So first and the most important is minimize your exposure. Best times of the day to get burned are between 10 and 4, where the sun is the brightest. The second is cover up if you're out. There are clothing now that has SPF ratings or UPF ratings, they call it, where that'll actually block UV radiation from hitting your skin. And lastly is wear sunscreen and wear it appropriately.
What are some early signs or symptoms of skin cancer to look out for?
Changes in your skin, new lesions that grow and don't go away, are generally things that should be looked at, especially if you fall into the higher risk categories. And so if you notice these lesions, talk to your primary physician, and usually that will result in a referral to a dermatologist who can then examine your skin and evaluate what your skin cancer risk is and if the lesion is one of concern. Specifically for pigmented or brown lesions, we always use what we call the ABCDE algorithm. A is asymmetry. If you have a mole that's uneven on each side, it should be looked at. B is border. If the border is irregular on a mole, you should have that looked at. C is color. The mole should be a fairly uniform color. If it has areas that are darker or lighter or it changes in color, that needs to be evaluated. D is diameter. Bigger mole, generally we use 5 to 6 millimeters or 1/4 of an inch. If it's bigger than that, it's something that should be paid attention to and looked at. And lastly is evolution, a mole that changes.
What are the most effective ways to detect skin cancer early?
Know your skin. That's really, look at your skin, areas that have changed. Remember, cancers won't go away.
Yeah.
So if you have a new lesion and it's growing, changing, and it won't go away with simple creams or ointments, it's something that needs to be looked at.
So take the time to notice.
Take the time to notice.
Are there any specific lifestyle changes or habits that can significantly reduce the chance of developing skin cancer?
And that's, yes, stay out of the sun.
Yeah.
Ultimately, that's the biggest single thing that we can do. But if you're in the sun, acknowledge the risk and protect yourself. The biggest mistake people make is with sunscreen or is not applying it often enough and thoroughly enough and not acknowledging the exposure.
For more information, all you have to do is give them a call at 210-946-1400 or visit the website surgeoncsouth.texas.com/more-info. You can also scan the QR code on your screen. Doctor, once again, thank you.
You're most welcome.